Hey guys, myself Tejas. I will be starting with systemic microbiome today. I will begin with gastrointestinal infections. Today I will be discussing about rotavirus diarrhea. Let's begin. I will discuss rotavirus diarrhea under following headings. First, I will discuss the causative organism, followed by morphology, pathogenesis, clinical manifestations, lab diagnosis, treatment, and finally the prevention. Even in university exam, present the answers under same headings. You will get maximum marks. Let's begin with the causative organism and morphology of causative organism. Rotavirus diarrhea is caused by rotavirus. Rotavirus is a RNA virus and it belongs to family Reoviridae. Rotavirus diarrhea is caused by rotavirus. Rotavirus is a RNA virus and it belongs to family Reoviridae. Rotavirus enters the body through feco-oral route. Feco-oral route means entry of pathogen into the body by ingestion of food and fluid that is contaminated with fecal matter of the infected person. Rotavirus enters gastrointestinal tract through feco-oral route. Rotavirus enters the gastrointestinal tract through feco-oral route. Once it enters the gastrointestinal tract, it moves to the intestine and enters the enterocytes. It moves to the intestine and enters enterocytes. Enterocytes are cells of intestinal lining. Once it enters enterocytes, it multiplies in cytoplasm of enterocytes. Once it enters enterocytes, it multiplies in cytoplasm of enterocytes and damages transport mechanism in enterocytes. Once it enters enterocytes, it multiplies in cytoplasm of enterocytes and damages transport mechanism of enterocytes, which results in secretory diarrhea. This is the pathogenesis of rotavirus. I will quickly summarize it. Rotavirus enters through feco-oral route. Rotavirus enters gastrointestinal tract through feco-oral route. Once it enters gastrointestinal tract, it moves to the intestine and enters enterocytes. Once it enters enterocytes, it multiplies in cytoplasm of enterocytes and damages transport mechanism of enterocytes, which results in secretory diarrhea. I have finished discussing about pathogenesis. Now I will start the clinical features. Incubation period means time interval between entry of pathogen and appearance of first sign or symptom. Incubation period means time interval between entry of pathogen into the body and appearance of first sign or symptom. In rotavirus diarrhea, incubation period is 1 to 3 days and disease is abrupt in onset. Abrupt in onset means sudden appearance of symptom. First, vomiting occurs, which is followed by watery diarrhea, fever, and abdominal pain. These are the presenting features. Recovery occurs in majority of cases, but few children may suffer from severe loss of fluids and electrolytes because of vomiting and watery diarrhea, which will lead to dehydration. Adults are usually asymptomatic. We are done with clinical features. I will quickly summarize it. After that, I will start lab diagnosis. Incubation period is 1 to 3 days and the disease is abrupt in onset. Vomiting appears first, which is followed by watery diarrhea, fever, and abdominal pain. These are the complaints with which patient presents. Recovery occurs in majority of cases, but few children may suffer from severe loss of fluids and electrolytes, which leads to dehydration. Adults are usually asymptomatic. Sample collected is fecus of the patient. Virus antigen is detected in stool of patient by ELISA. Virus can be detected directly in stools by immunoelectron microscopy, and isolation of rotavirus is difficult. So it is not possible to culture the virus. RT-PCR is the most sensitive method for detection of rotavirus, and rise of antibody titer in serum against rotavirus can be detected by ELISA. We are done with lab diagnosis. I will quickly summarize it, then I will start the treatment. Specimen collected is fecus and virus antigen is detected in stool by ELISA. Virus can be detected directly in stool by immunoelectron microscopy, and isolation of rotavirus is difficult. So it is very difficult to culture the rotavirus. Most sensitive method for detection of rotavirus is RT-PCR, and rise of antibody titer in serum can be detected by ELISA. There is no specific treatment, mainly supportive care is given, like correction of loss of water and electrolytes through oral or parenteral fluid replacement. Because there is loss of water and electrolytes due to secretory diarrhea and vomiting, so correction of loss of water and electrolytes is important. ORS should be given to the patients suffering from rotavirus diarrhea. Rotavirus can be prevented by following general preventive measures and administration of vaccine. General preventive measures includes improvement of sanitation and hygiene in community and following strict hand hygiene if you are in contact with patient suffering from rotavirus diarrhea. Following strict hand hygiene and improvement of sanitation and hygiene in community can prevent rotavirus diarrhea. There are two brands of vaccine available against rotavirus. One is Rotavac and another is Rotarix. Both are live attenuated vaccine. Rotavac and Rotarix are live attenuated vaccine. Live attenuated vaccine means live attenuated organism is used in the vaccine. Rotavac is given as 3 doses. First dose is administered at 6 weeks of age. Second dose is administered at 10 weeks of age. And third dose is administered at 14 weeks of age. Rotavac is given as 3 doses. First dose is administered at 6 weeks of age. Second dose is administered at 10 weeks of age. And third dose is administered at 14 weeks of age. Rotavac is given along with DPT vaccine and OPV. Rotavac vaccine is given along with DPT vaccine and OPV. Rotarix is given as 2 doses. First dose is administered at 6 weeks and second dose is administered 4 weeks later. First dose is administered at 6 weeks and second dose is administered 4 weeks later. We are done with rotavirus diarrhea. Thank you for listening with patience.